Important phases of the gross motor development milestones of a child starts with a child capability of holding his neck. So when a child is capable of holding his neck, he is almost should be at the age of 3 months. Then a child capable of rolling over. This is, you can see, a child capable of rolling over. This is 5 months of age usually. Then another milestone is child sitting in a tripod position. So this is a typical tripod position. So this is achieved at the age of 6 months to 8 months. Initially, a child will sit with support, usually at 6 months. Then a child should be capable of sitting without support. This is usually about 8 months. Then the next important milestone is standing with support. Okay, so standing with support is the first milestone. The child will be standing by holding the things. This is usually achieved at 9 months of age. Then we have stand without support. Okay, so first was standing with support, then stand without support. You can see child is standing without support. This is achieved at 12 months of age. And child is also capable of walking, but he falls, and he can also creeps well. Then we have walking alone. Okay, so child can walk now without falling. This is an important milestone achieved at 15 months of age. He can creeps upstairs as well. So he will be creeping upstairs. And then another milestone is he is now capable of running. Okay, the child first was walking, now he is capable of running. It is achieved at 18 months of age. Then we have walking up and downstairs. So when a child is capable of walking upstairs and downstairs, he is almost 2 years of age. He can also jump. Then he can ride a tricycle. So riding a tricycle has 3 tires. So remember, 3 years of age and 3 tires. This is how you can remember. Then a child hops on his 1 foot. He is capable of lifting his 1 foot, you can see. So this is a milestone achieved at 4 years of age.